www.healthcmi.com. Acupuncture continuing education online today. Acupuncture MRI results after ischemic stroke. Published December 6, 2018 at healthcmi.com. Click on news and look for the article. Today, we find that acupuncture regulates brain regions for stroke patients. Southern Medical University researchers gathered MRI data in a controlled clinical trial consisting of both healthy subjects and patients suffering from stroke. In a controlled human clinical trial, Guan, that's triple burner 5, the acupuncture point on the forearm, applied to the right arm produced significant MRI findings. True acupuncture caused important changes in brain functional connectivity. Essentially, what happened was by needling this point after a stroke, it helps the brain recover. This article at Health CMI goes into the exact details and gives a little bit of history dating all the way back from the Yellow Emperor's Classic of Chinese Medicine to today's findings about MRIs and all about the acupuncture point. In addition to that study, which does get a little heady, there's a great one at the end by Yang and others, and that one goes into some other acupuncture points, which is Bai Hui, which is on the top of the head, and GB26 Shui Go, and some other points, and what they can do. And here's some interesting quotes from that study. They note that acupuncture has the ability to promote the proliferation and differentiation of neural stem cells in the brain, accelerate angiogenesis, and inhibit cell death, and prevent and treat neural injuries following cerebral ischemia. So when there's less circulation and blood and nutrients to the brain. They've added a bunch of other things in there too that are really interesting, including how acupuncture helps synthesize neurotransmitters and metabolize toxic substances. The real message here is that laboratory experiments, and they get very detailed, by the way, in the specific actions that happen in the brain as a result of acupuncture and what points initiate those changes. The real point here is that acupuncture is very beneficial to patients who have had a stroke, but I will add that it is time dependent. In other words, if an acupuncturist can see someone in a short window of time after a stroke, certainly within 1 to 3 weeks after a stroke, that's when we're going to get the best results. Once time starts moving on, it's much more difficult. If a patient comes into us a year later and we try to get the results, it's not going to be the same in terms of reversing something like paralysis or helping speech return, these types of things. Normally, we can't expect great results. This is not to say that we can't get good results, but it will be so much harder and the likelihood much smaller. So the best window of time is right away after a stroke. 24 to 72 hours is the first window of time for superb results. There is a 1 to 3 week window where we can still have pretty amazing results in terms of restoration of motion and restoration of clarity. But after that, it can be very challenging. However, I have seen results where people come in a year later and get, great clinical outcomes. It's just not as common. It's often harder to get. So expectations have to be clear that timeliness is very important in terms of patient care. This is an excellent piece of research. It gets very detailed about the exact brain centers. They get activated and regulated as a result of acupuncture. So it's really worth looking at. And I want to thank everyone for listening about this very important topic. www.healthcmi.com